Today we are going to learn how to recognize a lesion as an OSSN, Ocular Surface Squamous Neoplasia, which can present in different ways. It is a spectrum. But typically, how can you recognize in an eye? So when a patient presents with a growth, like in this case, it's a 70-year-old gentleman. So the age itself can tell you something. If it is a young young male, young female, we usually suspect immune deficiency disorder. So you have to screen for any disease which can cause immune deficiency, especially HIV. In this patient, is typically an old elderly male, age of 70, and complaining of basically a slow growth in his left eye. So whenever we see a lesion, this lesion is present between the upper and lower eyelid, interpalpable. So one of the point in diagnosing OSSN is that, and it's always even pterygium present between the less upper eyelid and lower eyelid, and it doesn't mean that OSSN cannot present in other parts of the eye. It can also present in the caruncle. It can also present in the upper and lower bulbar surface area. But typically it presents between upper and lower eyelids. So when it presents, the history says is there was slow progression of fleshy mass, no history of pain. Some can have slight discomfort. So this patient, you can see in the left eye, there is a fleshy mass, and what we can know is that this mass, this fleshy mass, also has some it's like thick. It's like there's a slimy covering of the mass, which is usually because of the keratin. So there's a keratin, which is a typical finding in OSSN. And also, if you look closely, we can see an intrinsic vascularity. So the mass also has this kind of vessels, dilated vessels, tortuous vessels, which is known as feeder vessel, and also present typically. And OSSN is usually a clinical diagnosis. And confirmatory test is basically we can do intersegment ASOCT, and the confirmatory test, the gold standard is usually excision biopsy. But clinically is a clinical diagnosis, so we have to basically diagnose it clinically. We shouldn't miss this lesion. So we have to have a keratin, we have to have intrinsic vascularity, there's a feeder vessel, it's present between the upper and lower eyelid, and there's a history of slow progression of the fleshy mass. And usually it's present in the limbal area, which encourages the cornea. So typically this is the presentation of OSSN, and it can present in there are different spectrum of OSSN which can present like in different locations, different kinds of growth, and different invasions and different progressions. Like especially in immune deficiency, they can progress really fast. So that's why in young people we have to rule out immune deficiency syndrome.